Okay, now we saw about engulfing the microorganism. So that is phagocytosis. So we have to know what if this phagocytosis does not happen properly. So when there is a disorder in this phagocytosis, what is going to happen? So you need to know there's something called Chediakigashi Syndrome. Just key points you need to know. Chediakigashi Syndrome, in this, the ability of the phagocytes to store the material in lysosomes or release their contents is gone. So which means the ability is reduced. Chediakigashi means ability is reduced. So recurrent pyogenic infection you will get. A recurrent infection you will get. Chediakigashi, reduced ability, recurrent infection. That is the first point. Chediakigashi, you have to remember, or reduced ability, recurrent infection. Number 2 is chronic granulomatous disease. In this, reduced production of H2O2. So in first, ability is reduced. In second, production is reduced. That is the point you need to know. Chronic granulomatous disease. So what happens here? You get fungal infection also. So bacterial, along with bacterial, you get fungal infection also. So chronic granulomatous disease. Number 3 is Job syndrome. Here, what happens? The response is reduced. Reduced response. So the response is reduced in Job syndrome. So you get recurrent abscess, recurrent cold abscess and eczema. Next is lazy leukocyte. So what happens here? Reduced movement, the migration, the movement of the neutrophils is reduced. So you just get low grade infections because it is lazy, but it will still reach. So slowly they will reach. So there's always some low grade fever the patient is going to have. Next is leukocyte adhesion deficiency, which means adhesion is reduced. We saw yesterday margination, rolling, adhesion, migration, finally. So these points you need to know. Next is myeloperoxidase deficiency, which means reduced acid production, HOCl production. So the killing is going to be delayed. There is going to be killing, but the killing is going to be delayed. So all points are important. They are all MCQs. Am I clear till now? Is everyone clear? Very good. Next. I am skipping this point, acute versus chronic inflammation. We talked a lot about acute versus chronic inflammation, so I'm skipping this point. Then, graft and their rejection. So you need to know there are 4 grafts: autograft, isograft, allograft, xenograft. So one part of the body to another part of the body within the same individual is going to be autograft. So one human to another human is going to be either isograft or allograft. But xeno is between 2 species. So do not expect a question from xenograft. You are going to get questions from these 3: auto, iso and allo. So iso means twins. Iso means iso twins. Allo means between 2 different members. Allo means between 2 different members. Iso means twins. These are the only 2 points you need to know from here. So what are we going to do? Organ transplantation. If we transplant one organ to another, from one organ to another organ from the same person, that is autograft. From twins, that is isograft. From 2 different people, that is allograft. Okay. Then we saw about the reactions. Transplant rejection. So transplant rejection. So you have to know it can be acute, it can be hyperacute, it can be chronic or graft versus host, which I told yesterday itself. So hyperacute is the one that occurs immediately. Hyperacute occurs immediately. Acute takes time. Chronic takes more time. Graft versus host, you can't actually say. In graft versus host, you cannot say the time. So what you need to know from here is hyperacute is type 2 hypersensitivity reaction. Acute is type 4 hypersensitivity reaction. Chronic is type 3 and type 4 hypersensitivity reaction. Graft versus is type 4 hypersensitivity reaction. So chronic you can follow type 3. So chronic follow type 3. Type 3 hypersensitivity reaction for chronic. Graft versus host, you can follow type 4. So acute and graft versus host, you can follow type 4. Hyperacute type 2, chronic is type 3. Am I clear in this topic? Very good. Okay. Now going forward. So immunoglobulin I am not going to talk because this is what we talked yesterday. Hypersensitivity we talked yesterday. So regarding the other names, this is what we missed yesterday. I think we didn't have time to cover that. So the names you need to know: type 1 is anaphylactic type, that is immediate type. Type 2 is cytotoxic type. Type 3 is immune complex type. Type 4 is delayed type. Okay. Type 5 is stimulatory hypersensitivity. Stimulatory hypersensitivity. So you need to know type 1, 2, 3 and 5. So you can even skip 5. Type 1, 2 and 3 are antibody mediated, whereas type 4 is cell mediated. This point is very important. Type 4 is cell mediated. Okay. This point is very essential. So note these points, these are essential. Type 1 anaphylactic or immediate. So type 1 is immediate, type 2 is cytotoxic, killing the cells. Type 3 is immune complex, type 4 is delayed type. So we saw a lot of examples. So you will have to read much more examples. Next is immunodeficiencies list of immunodeficiencies. So you need to know when the T cell is gone or the B cell is gone, when the T cell or the B cell, when they are gone, what is going to happen? So when the T cell is gone, you are going to get something called Dye-George effect. Dye-George effect. Okay. So for this, I would like to give a mnemonic, that is, so if you miss this in exam, you will feel a lot. So you have to memorize right away. When the lecture is happening, you must memorize. So I will provide mnemonic here and there. So George died in Taiwan. George dies in Taiwan. So this is what you're going to remember. So George die, which is Dye-George, means Taiwan. That is T cell. So this is essential. Next is B cell. B cell defect are going to be these three. In this table, you don't have to remember the defect. All you need to know is the names that are coming, syndromes that are coming under the defects. So B cell defect means X-linked A gamma globulinemia, common variable immunodeficiency, and immunodeficiency which hyper IgM. So this you need to memorize. B cell defect means X-linked A gamma globulinemia, common variable immunodeficiency with hyper IgM. Okay. So I think I can give a mnemonic for this also. I just thought of one, maybe it may be helpful. So this is B cell defect. So in local terms, you can use a word that is sorry, Bunyan. Remember the Bunyan that we use, the bunions. So there are two things that are very commonly selling or most selling in Bunyan, two sizes. One is XL size, another is medium size. Just remember this point. XL size, medium size. These two are very common. So these two are very common. So common stands for common variable immunodeficiency. XL stands for X-linked agammaglobulinemia. Medium M stands for IgM, hyper IgM. So IgM, XL, these two sizes are very common. So in bunion, these two sizes are very common. Can you remember this? Is this fine? Okay. Next is combined B cell and T cell defect. The other syndromes, Nesloff syndrome, ataxia telangiectasia, Wiskott-Aldrich syndrome, severe combined immunodeficiency. So if you rule out this bunion and this George, anything else is going to be combined immunodeficiency. So XL and M are common in bunion. So B cell, common, XL and M, IgM. Okay. So X-linked agammaglobulinemia and IgM, and common variable immunodeficiency. George dies in Taiwan. So Taiwan, why I said, because it is thymic hypoplasia, which is a very important MCQ. In Taiwan, a lot of people will be short. So thymic hypoplasia, you need to remember what happens, hyperplasia or hypoplasia. You have to remember it is hypoplasia. In Taiwan, every people is short. So the thymus is short. So hypoplasia in thymus, that is Dyegeorge syndrome. That is a highly repeated MCQ. And Dyegeorge syndrome is a T cell defect. That is second highly repeated MCQ. So in this entire table, if you take one point which is essential most, means Dyegeorge syndrome. So you should never forget this point. Okay. I'm stopping again here. I want to reconfirm. Am I clear till now, everyone? So will you be able to make all the questions from immune system? Because if you don't get the concepts in immune system, you cannot sort it out. Okay, very good. Now, I can skip this infection that can cause immunosuppression. That's not important. Miscellaneous test. So test and all we will see anyways. Sterilization, disinfection, we will see anyways. Okay, so that's it. Other than this, we should know how to sterilize and disinfect, and what are the tests that are coming in your microbiology, the type of test, and what are they used to diagnose. So we will see a lot of tests. Here are some serological tests you will have to know. So I'll just read it out for now, but we will cover anyway when we are reading the microbiology further. So you need to know Ascoli thermoprecipitation test is a ring precipitation. Landsfield test is a ring precipitation. So tube precipitation means Korn flocculation test. Tube agglutination means Paul Bunnell test. VD oral is a slide test. Rose Valor is a passive heme agglutination test. Vidal is a tube agglutination test again. Weil Felix is a heterophile tube agglutination test. Wassermann reaction is a complement fixation test. So these are the different tests you should know. Serological test. Everything is in one place. So these are important for your MCQ. The famous MCQ from here, is Vidal is tube agglutination test and VD oral is slide precipitation test. These two are the most famous MCQ. Followed by Weil Felix test is a heterophile tube agglutination test. So if you know at least these three, your exam should go smooth. I hope I'm clear here. So we can stop this here. Now we can start with our microbiology. Am I clear, everyone? The reason I'm saying is